Day zero is the moment before company formation, when a founder decides to take the plunge, follow their dream, and commit to pursuing their vision of change. On day zero, you'll hear founders tell their story. From the initial idea, through reactions by critics and skeptics, setbacks and successes, we'll cover it all. Behind every company is a founder with ambition, goals, dreams, and wisdom to be shared. Let's explore them together.
Well, Dan, thank you so much for joining us at this episode of Day Zero, where we interview founders and talk about the founder story. And so just here to join by Dan, the co-founder and CEO of MedArrive. Thanks so much, Dan, for joining us.
Lynn, a pleasure. We've come a long way to this conversation today, and always great to be with you. So thank you for having me.
We have. That's absolutely true, Dan. So how about this? I'd love to start from the very beginning in terms of what inspires you to be an entrepreneur. Did you wake up one day and say, this is what I want to be? Talk a little bit about that journey.
Yeah, happy to. So I think, I've shared this story throughout my career. I think a big thing that defines me, kind of tells people a lot about kind of where I've come from and my beginnings. You know, I'm a first generation American, come from a family of immigrants. My parents, my sister, all immigrated from the former Soviet Union. Now it's the Ukraine of all places, and that's a whole nother conversation of what's going on there. My family is all from the city of Odessa, which is on the Black Sea there. Certainly been in the news for not so great things recently. But they came here and literally left everything that they knew as children, really for a better opportunity for their family and for their kids. And that really is that, that seed inside of me. It's that, really believing that, I tell my kids this every single day, you can do anything. And for all the faults of our country, I still believe this is the best country in the world. And you can absolutely do anything you want if you simply just work hard. And that's another thing I always tell my kids when they go to bed, work hard when you wake up in the morning. And so I think that's always been, inside me and has really inspired me to want to build a better life for my family than what my parents had and having this unique opportunity to do so here. And so, I think every step in my journey to where I am today has kind of led me here. It started with building my core skill set in consulting and investment banking in my early days coming out of college. Really started to spend a lot of my time in the healthcare vertical. Spent a lot of time working on healthcare transactions at my investment bank. And then also through my family, actually my father-in-law, who I've known for 15 years, just as long as my wife, he built a very successful business. He was an entrepreneur himself. He built a very large home care business here in the Bay Area, non-medical home care, helping folks with mostly activities of daily living, private duty, literally from nothing to over 500 caregivers serving the greater Bay Area. And I really saw the opportunity within healthcare. The other thing I'd say, just as a side note, my parents came from a world where going to a hospital was an absolutely foreign concept unless it came to end of life care. And this idea of why would I go to a hospital where people are sick or where I can get sick? House calls was the norm. And they always saw physicians or doctors coming to them. And so, when they came here, they thought it was really odd going into a doctor's office. And that I think was a bug in the back of my head that always kind of, really showed that there's a lot more opportunity to create a better infrastructure here. And so for all those experiences and doing a few other startups throughout my career up to this point, I think all those things really led me to want to do more, to have a bigger impact, and really build something of my own and really have, my hands on something where I can control my destiny. I can control the ultimate outcome.
Yeah, absolutely. I mean, so amazing through your family influences and just being seeped in this industry for so long. And maybe tie in, I mean, the other interesting area that you were in is you were at Uber before. And so how did that all roll into then MedArrive for you?
Yeah. So, and even prior to Uber, I actually worked at Lyft. I was doing essentially a very similar role at both. I was the first healthcare hire at Lyft, back when Lyft was a few hundred employees at the time. And in 2.5 years on the healthcare team and helping to build that at Lyft, we built a $500 million business around non-emergency medical transportation. Small side note, most people don't know this, but the US government, CMS, spends $6 billion a year on transportation services for Medicare and Medicaid recipients. 80% of that volume, those rides, are what's known as curb to curb ambulatory transportation, meaning these are people who can get in and out of a car on their own. And the vast majority, if not all of that, was going to taxis. So this was kind of one of the last meccas, if you want to call it, for rideshare to really disrupt traditional taxi services and within the healthcare vertical. I really saw the power at Lyft and Uber of a marketplace, of technology, of a platform within a healthcare vertical. And even more interestingly, I saw the power for more underserved, vulnerable populations. We built tools where a health plan or a healthcare provider can order a ride on behalf of a Medicaid recipient, on behalf of a 90-year-old woman who can't get to her medical appointment and that lives in the transportation desert. This was done all for them. They didn't need an app. They didn't need to know anything about Uber and Lyft. And we built a very successful business that had some amazing stories of really helping some of our most underserved populations. I went over to Uber. We did it at a much larger scale. We did meal delivery in healthcare. We did pharmaceutical delivery as well. And again, that really showed me the power of a marketplace within healthcare. And that really inspired me to say, there's so much more we can do. And as a side note, Uber and Lyft are not healthcare companies. I mean, if you look at their stock price these days, they've got lots of other things to worry about than the healthcare division. Even though, they're continuing to do some work there, I fundamentally believe they can do so much more, but it wasn't the core focus. And you couldn't blame Dara for not devoting more resources, given, it's a fraction of their P&L. I wanted to do more, and I wanted to build a platform within healthcare and really focus on these more vulnerable populations. And that's really what inspired me to do what we're doing today at MedArrive.
That's amazing. So talk to us a little bit about MedArrive and how you've built the business from the very beginning and then, over the last couple of years.
So it's only been 2 years now, which is crazy. It feels like 20 years. And there's been a lot of twists and turns and ups and downs and a lot of fortuitous interactions and connections. But it's been a great journey. And I think it all starts first and foremost. If I was going to talk to any founder, if anyone was going to ask me what leads to the opportunity to build a successful business, it all comes down to people. And I truly believe it's all about your co-founder. It's all about the team you've built. And it's all about the culture and infrastructure you're building in every single hire you make. That is what leads to success. Ideas are a dime a dozen. I'd rather have, pardon my French, a shitty idea and a world-class team than the inverse of that. The best idea in the world, but a really crappy team. And that, I think, is really what has led to our opportunity to build this business and ultimately lead to some of the success we've had. So it all comes down to my co-founder, Ina. I was very fortunate. About 2 years ago, I was approached by Ina, and actually our original investor in the business, an organization called Redesign Health out of New York. They're a venture fund, but what's unique about them is they have a full-time team of people who come up with ideas internally that they really perceive as opportunities in healthcare. And if they like it enough, they'll seed fund it, hire the founding team, companies off to the races. And so Ina, my co-founder, was actually on that founding team of Redesign. She launched a few businesses in the healthcare vertical. And then given COVID and the need to bring high quality, low cost care into the home, she saw this unique opportunity, which at the time didn't even have a name, which ultimately became MedArrive. Ina wrote the original business plan and approached me when I was at Uber and said, listen, I think you have a really interesting background here. And we ultimately found that our skill sets very well complemented one another. She has a deep operations background. She worked at Blue Apron in the early days, ran their entire supply chain. And we really came together and said, listen, we think we have a great fit just between the two of us. And that was the most important thing. And then ultimately also had a great business idea. And so we came together through that relationship, raised some seed capital, really defined what the business model was and really refined what our go-to-market approach would be, had some early traction, started building a team, raising some more capital, and ultimately got to where we are today. So I think, again, it really came down to those human interactions, the people, my co-founder, and the early team we're able to build, I think were instrumental to getting us to where we are today.
Yeah. And maybe talk a little bit, Dan, about the business, how it started and where you are today.
Yeah. So at a high level, we fundamentally believe, like many other companies out there today, that clinical services are moving into the home. You ask me, what does a hospital look like in 10 years? I think fundamentally it might just be an OR, an ER, an ICU, and the vast majority, if not everything else, will move to the home. McKinsey came out with a really good report about 3 months ago now, saying that $250 billion of care services will move into the home between now and 2025. There's no question that this is the trend. And so lots of companies in this space. Now, as a side note, it's not a winner take all. It's not one company that's going to do everything. And there's lots of white space. So at the core of MedArrive, we believe in bringing high quality clinical care into the home. However, we have a much different approach and different tact at this market. At the core of MedArrive, we're a three-sided platform. There's three key stakeholders who we build and solve for. The first, a patient or a health plan member. That is our ultimate user, and we design everything for. The second component of our three-legged stool is what we call our demand partners, or essentially our customers. And those at the core are value-based providers and payers. Those are our core customers today. Managed Medicaid plans, MA plans, Medicare Advantage, and ACOs. We want to build tools for them to better serve those they care for into the home. So just to be clear, we're not a consumer business. We're not trying to build a consumer brand. We're not trying to go D2C, build a beautiful app, put it in the app store, someone downloads it, and gets on-demand healthcare. I've worked at Uber and Lyft. It's hard enough to get a millennial to a bar on a Friday night trying to deliver on-demand healthcare. And oh, by the way, doing that margin positive and actually generating a profit and doing it with good SLAs in rural markets is near impossible. So our approach was, let's build tools for payers, primarily, who have these populations that are mostly vulnerable and underserved. This isn't designed for somebody who can afford for on-demand concierge care or knows how to use an app. We are primarily focused for populations that are managed Medicaid, as I said earlier, who are typically high ED utilizers. These are people going to the ED 5-6 times a month where the total cost of care is exorbitant. So we want to serve these populations. And then finally, the third piece of that three-legged stool is our providers. Who's going into the home? And at the core of our providers are EMS professionals. So we are leveraging EMTs and paramedics, who we believe are one of the most underutilized resources in healthcare, cost-effective, highly clinically trained, skilled, and scoped, and everywhere. They're in rural markets and large metropolitan areas to provide these valuable services into the home. And we've developed an infrastructure to tap into that labor pool. So that is the core platform. That is the core customer that we're going after. And essentially, yes, we're a technology company, but we're just as much a service business. We're a technology-enabled service provider, and we bring all these three stakeholders together.
Yeah. Dan, I mean, amazing though, as you think about your journey as an entrepreneur and what inspires you and how you started this, right? In terms of how your parents, received healthcare all the way to kind of your familial influences to come to this moment and this model and this solution for healthcare and how necessary it is truly is so integrated. So let's talk about COVID in two ways, actually. One is COVID and how that became almost like a wedge for your business, and then how you evolved from that. But then secondly, what it was like to build a company in COVID, truly in the very beginning stages. So let's first talk about the first, which is kind of what that has meant for the business. And then maybe we talk about company building during COVID.
Yeah, so a couple of things. One, I'd even take the story back even pre-COVID. And I talked about the delivery model of care in the former Soviet Union where my parents grew up. Well, even historically in the US, healthcare was really delivered in the home. And, house calls, doctors on demand was, not a novel concept in the early days of our healthcare system in the US. And frankly, the only time people usually went to the hospital was for end of life care. I mean, that was really the original inception of hospitals and why they were created. Now, a lot has certainly changed over the last century when it comes to delivering care into the home. And so COVID was really an accelerant to really shifting expectations. And the other tailwind, even pre-COVID, was the whole shift of on-demand services, models like Uber and Lyft and Amazon, and really shifting consumer expectations of services meeting people and goods meeting people where they are. And so COVID was really the accelerant that really continued to move that trend forward and enable a platform like MedArrive to thrive. The other key trend during COVID was telehealth services. I think at the peak of COVID, we saw around 60% utilization in telehealth services. Today, we shouldn't say post-COVID, but we're certainly still in the middle of it. Telehealth utilization is still, today around 20, 30%, certainly a lot more than it was pre-COVID. And it is here to stay. But as we like to say at MedArrive, there's no humanity in telehealth. It's all virtual. There is no human contact. And one of the founding visions of MedArrive was always to be that bridge between on-site clinical care and pure telehealth service. And we want to be that physician extender into the home. We want to be the eyes and ears of a specialist, of a provider through telehealth with our network of providers. EMTs and paramedics cannot prescribe, they can't diagnose, they can't do HCC coding, but they can do all that with physician oversight through telemedicine. And so that is a core component of our infrastructure. So I think a lot of these trends, telehealth, consumer expectations, services coming into the home, and COVID really allowed us to build this model and do it at a much quicker pace than we could have pre-COVID. And originally, one of the first use cases for us was actually talking to large health plans and them saying, okay, listen, I like your model, I like what you're doing, but you got to prove it to us. We have homebound populations in really underserved rural markets who can't get to a vaccine site to get a COVID vaccine. Can you deliver vaccinations into the home? And oh, by the way, your cost to do that relative to a hospitalization for COVID is well worth it. The ROI on that program makes a ton of sense for a plan. And so we used that as an early use case for MedArrive and actually got great traction there. We got MSAs with large health plans. We executed on that. We proved ourselves. And now we've been expanding, moving away to much more higher value use cases. More longitudinal care where we're seeing people multiple times, not just for one visit for a vaccine. And then the last thing I'd say is Scan Health Plan was one of those first customers. And now Scan is an investor, given how well that program went. So, COVID really changed a lot for us and allowed us to get to where we are today. On the team front, it's a very interesting time to be building a business. And I think, today we have, just under 40 corporate employees. I think they live in about 13, 14 different states across the country. There is no doubt in my mind you can build a very successful business that is fully remote. And there are ways, there are tools, there are ways to build culture, to build that sense of belonging, to build that sense of mission and culture. You can do that remotely. And frankly, we can hire much better talent. We can now hire talent from all across the country and more diverse talent. And that I think is extremely important, especially within healthcare and especially when you're building a tool to serve vulnerable populations. I'm proud to say that about 60% of our workforce today is female and over 30% of our workforce today is from underrepresented minority groups. And we can always get better at that. And I firmly believe that our team, our corporate staff has to look and come from the communities that we serve because ultimately I can't pretend to understand their needs as well as people from those communities. And you can do that even better in a remote first environment. And I think that's been really core to how we thought about building our team during COVID.
Yeah, Dan, I would always say you've been so thoughtful about your team, your culture, and it really impresses me every time in a board deck. You have a couple slides on culture and team and how you're building that in a remote workplace that is really distinctive, I think, in how you're building your team and what you guys are tackling. So really appreciate
it. So Lynne, culture has been so important to us at MedArrive and fundamental to the team we've built. And I think at the core of it, it really came from my experiences of both working at Uber and Lyft. It's well documented. It's no secret. The early foundings of both companies and the cultures and the communities they built in the early days. I fundamentally believe that the only reason Lyft exists today, because it should have been all of Uber's market, frankly, but the only reason is the culture and the community and the infrastructure they built in the early days with the people at Lyft. And, one thing I'd say is a great example of that. When I was at an all hands at Lyft versus Uber, and they did all hands frequently. I believe at Lyft, we did them monthly. At Uber, I think it was biweekly. I never once met an Uber driver at an Uber all hands. At a Lyft all hands, I would meet a Lyft driver almost every single time and hear about the stories and hear about the impacts that those drivers were having on the platform. And I fundamentally, again, that comes down to that core, those core tenets that seep throughout the entire organization. And that's really been important to us at MedArrive and how, mission is critical to how we, reach our employees and get them excited about their work. The other thing I am very, very proud about is our corporate employees go into the field. They go on actual visits into some of the poorest, most underserved communities. As an example, in Houston, they spend a bunch of time out there going into the homes of the people that we impact and that we touch. Not only does it give them a sense of what we're actually doing, aside from running spreadsheets and writing code all day, but it also truly lets them experience the pain points of our platform. Where are there opportunities for improvement? And the last quick example I'll give you, I never appreciated Lyft as much as I did until after I signed up and became a Lyft driver and did a few rides on the platform and truly saw how the app works, how the experience is as me as a driver, the human interaction I'm having with the person in the back seat. And I think that is so important when you're building a business, and especially in those early days, because those early days set the foundation. They set the tone for the future and for all new hires. And when you become 1,000 people, all those things really make a big difference.
That's amazing. I mean, Dan, definitely at Define We Espouse trying to use our own solutions that we partner with and really try to go ground up, if you will. And just that's really inspirational in terms of your approach to team build culture. So just to kind of in closing and to wrap up, what are some advice you would give on new entrepreneurs that are maybe building their own businesses today?
Yeah. So I think a couple of key things come to mind. The first and foremost is believing in the mission, the core of the business, and believing in the impact it can have, and not doing it for the quote unquote wrong reasons. Not doing it for that big exit one day, not doing it because it's the cool thing to do or you want to have a good dinner conversation. And even more so if you're doing anything in healthcare. As my friends at Kaiser Permanente used to tell me at corporate, TTT. Things take time. And that was literally executives at Kaiser telling me when they were trying to work with me as a vendor. And so healthcare, it's not building the next social media app. It's not building a viral platform where if you build it, they will come. You spend some money on marketing and the funnel will fill instantly. It's a long haul, and you have to be in it for that long haul, and you have to be in it for the mission and at the core of what you're doing. That's first and foremost. The second thing, third thing, and fourth thing, people. It's having the right people around you. And I'm rarely ever the smartest person in the room, and with my team, when I'm on calls, I have been so blessed with the group I've been able to build at MedArrive. You can't overinvest in people, especially in the early days. And then the last thing I'd say is, one of my mantras is just relentless pursuit. And I firmly believe in that. I think it's the relentless pursuit and the mindset that it will happen. And, I played sports my entire life, played sports in college. And, I have a lot of sports analogies. And in sports, athletes, especially at the highest level, always talk about visualizing yourself holding the trophy, visualizing yourself making the game-winning play. And if you do it in your mind, it's a lot easier to do it when in reality. And I think, that relentless pursuit and that mindset is extremely important. Because, if it was easy, a lot of people would have done it already. If it was easy, your business would have already been built by now. And so, I think those are some of the key things that I've taken, with myself and with our team. And actually, I'd say, one more thing. It's also, taking care of yourself and physically and mentally. And I burnt out at Uber and Lyft. I was working, and I worked in investment banking prior to that. I was working 100-hour weeks. And, when you're young in your 20s, that's certainly somewhat sustainable and you can do that. But you have to take care of yourself physically and mentally. I used COVID as an opportunity to get back into some of the best physical shape I've ever been in my life. No question in my mind that's led to my success and my ability to execute and work at this type of level. You have to have a good mind and a good body, I think. And, I think good things will happen.
Well, Dan, I mean, it's just so inspirational from the beginning of your journey, what inspires you to what you're building and how you're changing the healthcare system to just how you approach culture, team building, and the tenets of being an entrepreneur. Thank you so much for joining us here at Day Zero. And thank you for your time and the inspiration.
Lynn, thank you. And thank you and Define for being a key member of that team and the people around us at MedArrive, and look forward to the next time we can have a conversation like this.
It's all you guys for sure. Thanks again, Dan.
Thanks, Lynn.